Okay, this is for deliverable 4. This is that challenging pediatric care summary. And this was kind of a fun one. This we saw over on the musculoskeletal pediatric orthopediatric side of our clinic. And we had this little guy come in, and he was saying that his shoulders kept popping out every time that he moved them. And this boy was a 13-year-old baseball player, and he noticed that every time he was raising his arms over the last few days that he was hearing this popping, and he kind of had some control over it, but it was also hurting, so we had to rule out a fracture on that as well. So um, first of all, we noticed that he has this immediate pain when he's doing this popping or feeling this popping, and also some limited range of motion. Over the previous few months, he had started doing some pitching, and that's when he started noticing it. He's doing a lot of overhand type pitching, and that's when he's feeling his shoulders slip during those periods. No previous fractures, no previous history, just a little bit of allergic rhinitis with allergies. So otherwise, pretty healthy exam for this guy. And our differential diagnoses, of course, are going to start with the anterior glenohumeral shoulder subluxation. And supportively, he doesn't have a history of any instability, no positive, or he did have positive apprehension and relocation tests. He didn't have any visible deformities, nothing shown up on the x-rays. Neurovascular status looked good. And then, of course, he did have the spontaneous reductions in the past as well. Other differential diagnoses that we ruled out: anterior shoulder dislocation. Again, supportively, he had the pop. He had the significant pain and limited shoulder motion, so we wanted to make sure that nothing was actually fractured. And x-rays did come back looking pretty good there, so that kind of ruled out that particular diagnosis. Rotator cuff strain was our third differential, and supportively, he's got the pain with movement, he's got the mild weaknesses with external rotation. But again, we ruled that out. MRI actually looked good, and because he had that recent reoccurrent instability episode, that kind of ruled out that particular diagnosis as well. Otherwise, he wouldn't be able to do that particular movement. So again, that is going to take us with the subluxation, if I never say that right. And he also seemed to have some control over the subluxation as well. And to the point where he was actually kind of doing it in the office on demand. So we talked to him a little bit about looking at not doing that in the future, because of course that can increase some of his pain and decrease some of the range of motion that he's experiencing. And we talked a little bit about proper care and treatment with some possible PT for the current pain and range of motion issues that he was having. Putting him in a sling for 3 to 5 days, icing every 2 to 3 hours. 20 minutes on, 20 minutes off sort of thing. Some ibuprofen as he needed for pain. Again, PT to make sure that we're emphasizing that rotator cuff stabilization. And he will actually come back and see us if he's got any more of that reoccurrent instability. He is going to be restricted from baseball. He wasn't real happy about that for a little bit. And then just some education with his reoccurrent risk and rehabilitation and injury prevention. So that's about that. It was a kind of challenging one just because it really involved looking at that x-ray very uh, particularly. And of course, with children, sometimes it's hard to find those minute details. Okay, thank you.